She's complaining of abdominal pain. This is a 25-year-old female without a primary care physician. G2, P2, last menstruation was 6 weeks ago and was normal for the patient, with a history of ovarian cysts, presenting with right lower quadrant abdominal pain that began approximately 3 hours ago. Pain is described as sharp, constant, non-radiating, with no triggers or alleviating factors, associated with nausea and vomiting. Denies fever, chest pain, dyspnea, diarrhea, dysuria, or vaginal bleeding. Past medical history is positive for ovarian cysts. Surgical history is positive for one C-section. Denies taking any medications and denies any allergies to any medications. Social history is negative for smoking, admits to occasional alcohol use, and denies illicit drug use. Vitals, on exam, her heart rate is 105 beats per minute. Blood pressure 123/83, respirations 20, and temperature of 98.9, and a pulse ox of 98% on room air. In general, the patient appears alert and oriented ×3 with no acute distress. Ear, nose, and throat exam demonstrates moist mucous membranes, no tonsillar erythema, and no tonsillar exudates. Neck is supple and non-tender. The chest exam is positive for tachycardia without murmurs, and the lungs are cleared of auscultation bilaterally. The abdomen demonstrates tenderness in the right lower quadrant with no guarding or rebound. There is a surgical scar from a previous C-section. Vaginal exam, there's no bleeding or discharge, no cervical motion tenderness. There is right adnexal tenderness. My differential includes pregnancy, ectopic pregnancy, ovarian torsion, appendicitis, ovarian cyst, and UTI. I'll be ordering a CBC, a BMP, a serum HCG reflex, UA, a pelvic ultrasound, and the CT of the abdomen and pelvis. Therapeutically, I'll be giving 4 milligrams of morphine IV. Ma'am, I'm Dr. Carlson. I'm the resident working with Dr. Matisse. He's the attending physician. Your nurse is Carmen. If you need anything, hit your nurse call button. I'll be ordering lab tests. I'll be giving you medications for your pain. You'll be receiving a CAT scan of your abdomen and an ultrasound of your pelvis. The lab test can take 1 to 2 hours to return. The CAT scan can take up to 2.5 hours, and the ultrasound can take up to 2.5 hours. I'll come back in 10 minutes to see if your pain has gotten any better after the medications. If you need anything else before then, just hit your nurse call button.